Hello everyone, today's interesting topic is dorsal venous arch of the foot. So this dorsal venous arch of the foot, we can see it's there on the dorsum of the foot. It has got a medial end, it has got a lateral end. This dorsal venous arch receives common digital veins from the clefts. 4 clefts are there, interdigital cleft from there. Okay. So each proper digital veins like this is the proper digital vein, unite to form a common digital vein at the cleft. The common digital veins then end in the dorsal venous arch. We can see one of the common digital vein here, and this is the dorsal venous arch. Now the medial end of the dorsal venous arch receives the proper digital vein of the great toe to form the long saphenous vein. The long saphenous vein begins at the medial end of dorsal venous arch after receiving the proper digital vein of the great toe. Then it runs on the medial margin of the foot. Then it runs in front of the medial malleolus along the medial border of the leg, goes behind the knee joint and the anterior medial surface of the thigh, and finally ends in femoral vein. So that is about the long saphenous vein, how it begins from the dorsal venous arch of the foot. This long saphenous vein is connected to the deep veins by perforator vein. There are 3 ankle perforator, approximately 1.5 inch, 2.5 inch and 3.5 inch above the ankle. They are called as ankle perforator, and 1 knee perforator that will be there behind the knee joint, and 1 hunter canal perforator that will be there in the thigh, middle of the thigh, and then long saphenous vein itself is a perforator. Then through these perforators are guarded by valve, the blood in the superficial veins end up in the deep veins. So that is about the long saphenous vein. Whereas the short saphenous vein begins from the lateral end of the dorsal venous arch after receiving the proper digital vein of the little toe, then goes behind the lateral malleolus. It goes behind the lateral malleolus. I'll show you another foot. So it goes behind the lateral malleolus. Behind the lateral malleolus, goes behind the leg and end in popliteal vein. So what is popliteal vein? It's a deep vein of the popliteal fossa. Short saphenous vein ends in popliteal vein, whereas the long saphenous vein ends in femoral vein. The long saphenous vein is along the medial margin of the entire lower limb, whereas the short saphenous vein is along the lateral margin of the leg. The long saphenous vein ascends in front of the medial malleolus, whereas the short saphenous vein goes behind the lateral malleolus. It goes behind the lateral malleolus. So this short saphenous vein drains a small strip of skin along the lateral margin of the foot and the back of the leg, and finally ends in popliteal vein. So these are the superficial veins of the lower limb. These superficial veins, whenever the dorsal venous arch of the hand is not accessible for IV access, that is IV injections or IV fluid infusion or withdrawal of blood, that time the long saphenous vein can be used. Also this dorsal venous arch of long saphenous vein can be used during coronary artery bypass surgery. Since the long saphenous vein contains valves, around 40 to 60 valves, the valves are directed towards the heart, so therefore when you take a graft, they will take this graft and reverse it and place it in the blocked area, across the blocked area, like a bypass road. Every main station will have a bypass road like that, which bypasses the city. Like that, the blocked area is bypassed, the congested area is bypassed by the long saphenous vein graft, but it is reverse saphenous graft. Why reverse? Because the valve will not allow the blood to flow downwards. Coronary artery blood flows downwards, right? So this has to be placed like this, reversed. It has to be flipped. That is the importance of long saphenous vein as a graft material in case of coronary artery bypass surgeries. Of course, nowadays so many graft material is available, but always the tissue which is there in the body itself is better than anything which is placed from outside. Any graft material, later it will again become blocked. Thank you for watching and learning from Logic Medico. Have a good day. Bye.